Hey everyone, welcome back to the channel. Today, we're diving into a fascinating yet rare genetic disorder, Dyskeratosis congenita. It's a condition that affects multiple body systems, primarily due to issues with telomeres. But don't worry, we'll break it down in a way that's super easy to understand. By the end of this video, you will know what causes it, how it's diagnosed, and what can be done to manage it. So, let's get started. Let's break down Dyskeratosis congenita, or DC. First things first, DC is a rare inherited disorder. This means it's passed down through families. The core issue with DC lies in telomere maintenance. Telomeres are like protective caps on the ends of our chromosomes. Think of them like the plastic tips on your shoelaces that prevent fraying. In DC, these telomeres wear down too quickly, leading to premature aging of cells. This accelerated aging process can cause a range of health challenges. One of the most serious is bone marrow failure, which disrupts the production of blood cells. Additionally, people with DC have an increased risk of developing various cancers. Because of these serious complications, early diagnosis of DC is crucial. It allows for timely management and care, which can significantly improve the quality of life for those affected. Now let's take a closer look at what Dyskeratosis congenita or DC is all about. Essentially, DC is a rare disorder that messes with our telomeres. Remember those protective caps on our chromosomes we talked about earlier? Well, in DC, these telomeres become way too short, causing cells to age prematurely. Now, what causes this telomere shortening? The culprit is genetic mutations. These mutations disrupt the normal maintenance of telomeres, leading to those critically short telomeres and the premature aging we mentioned. One of the major consequences of this premature aging is bone marrow failure. The bone marrow is responsible for producing our blood cells, and when it fails, it can lead to serious health problems. And that's not all. People with DC are also at higher risk of developing certain cancers, particularly leukemia and squamous cell carcinoma. This increased risk is likely due to the combination of premature aging and impaired DNA repair mechanisms. Now let's dive deeper into the genetics behind Dyskeratosis congenita. DC is an inherited disorder, meaning it's passed down through families, but it's not always straightforward. There are different ways it can be inherited. X-linked recessive. This means the mutation is on the X chromosome, and typically, males are more affected. Autosomal dominant. Only one copy of the mutated gene is needed to cause the disorder. Autosomal recessive. Two copies of the mutated gene, one from each parent, are needed. In X-linked recessive DC, the mutations affect a gene called DKC1, which is important for making a protein called dyskerine. This protein plays a crucial role in telomere maintenance. In autosomal dominant DC, mutations occur in genes like TERC, TERT, and RTEL1. These genes are also involved in telomere maintenance, and mutations in them disrupt this process. Finally, in autosomal recessive DC, mutations are found in genes like NOP10, NHP2, and PALN. These genes are also essential for telomere function, and mutations in them lead to telomere dysfunction. Regardless of the inheritance pattern or the specific gene involved, the end result is the same: critically short telomeres. These shortened telomeres trigger premature cell death, which contributes to the various symptoms of DC. Alright, we've talked about the genetics of Dyskeratosis congenita, or DC. Now let's explore how it actually shows up in those affected. DC often presents with what doctors call a classic triad of symptoms, and these are abnormal skin pigmentation. This can look like lazy patches of darker or lighter skin, kind of like a knit-like pattern. Nail dystrophy. The nails become brittle, ridged, or abnormally shaped. This can be uncomfortable and also affect how the nails look. Oral leukoplakia. White patches from inside the mouth, which can sometimes develop into cancerous lesions. But it's not just these three signs. DC can impact various parts of the body linked to other health issues. One major concern is bone marrow failure. The bone marrow is like the body's blood cell factory. When it fails, it can't produce enough healthy blood cells, leading to conditions like anemia. Another possible complication is pulmonary fibrosis, where the lungs develop scar tissue, making it difficult to breathe. This can significantly impact a person's quality of life. Liver fibrosis can also occur. affecting liver function and overall health. And as we mentioned before, individuals with DC have increased risk of developing various cancers, especially leukemia and squamous cell carcinoma. So, as you can see, DC is a complex disorder with a range of clinical features. It's important to be aware of all potential symptoms and complications so that individuals with DC can receive an appropriate care and monitoring. We have talked a lot about the symptoms of Dyskeratosis congenita. Now let's actually see what they look like. Here we have an image of a hand affected by DC. Notice the abnormal skin pigmentation with those lazy, net-like patterns of darker and lighter skin. You can also see some nail dystrophy, with the nails appearing thickened and discolored. The second image shows oral leukoplakia, which are those white patches inside the mouth. These patches can be precancerous, so it's important to monitor them closely. And here's another example of abnormal skin pigmentation on the neck. In the third photo, you can see how the skin has a reticulated pattern, with areas of both hyperpigmentation and hypopigmentation. In Dyskeratosis congenita, or DC, one of the key areas we see changes is in the nails. Let's take a closer look at what these nail abnormalities can look like. Let's look at the image on the left. Here we have a close-up of some fingers affected by DC. Notice how these nails are ridged and have an irregular texture. They might also be abnormally shaped or have a spoon-like appearance. Let's look at the image on the right now. In this image, we can see that the nails are discolored and have a brittle appearance. They might break or split easily, and in some cases, they might even separate from the nail bed. Now let's look at image A. This image shows a close-up of tongue affected by oral leukoplakia, a common symptom of DC. Notice the white patches on the surface of the tongue. These patches can be precancerous, so it's crucial to monitor them for any changes. Now let's look at image B. Here, we see a hand with nail dystrophy, another characteristic sign of DC. The nails are ridged, brittle, and abnormally shaped. In some cases, they might even separate from the nail bed. Now let's look at image C. This image shows abdominal skin pigmentation on the underarm area. Observe the lacy, reticulated pattern of darker and lighter skin. This type of pigmentation change is often one of the first noticeable signs of DC. Now let's take our attention to image D. Similarly, this image shows abnormal skin pigmentation on the neck. The skin has a mottled appearance with patches of varying colors. Diagnosis Dyskeratosis congenita, or DC, often involves a multi-pronged approach to get a clear picture. It usually starts with a clinical evaluation where the doctor assesses the patient's symptoms and medical history. But to confirm the diagnosis, several key tests are often used. One of the most important tests is telomere length testing. Remember those protective caps on our chromosomes? In DC, these telomeres are abnormally short. So, this test measures their length in specific blood cells to see if they fall below the expected range. Another crucial test is genetic testing. This helps identify any mutations in genes known to be associated with DC. Finding a specific mutations can confirm the diagnosis and also help predict the inheritance pattern. In some cases, a bone marrow biopsy might be necessary. This involves taking a small sample of bone marrow to examine under a microscope. It can help assess the health of the bone marrow and look for any signs of abnormalities, like low blood cell counts. Why is early diagnosis so important? Well, because it allows for timely management and treatment. The earlier DC is diagnosed, the better the chances of preventing or delaying serious complications, like bone marrow failure and cancer. Managing Dyskeratosis congenita, or DC, requires a multifaceted approach to address the various symptoms and potential complications. Effective management often involves a team of healthcare professionals, including hematologists, dermatologists, pulmonologists, and geneticists, working together to provide comprehensive care. Supportive care focuses on managing specific symptoms and complications. For example, transfusions might be necessary to treat anemia, and medications like GCSF can help stimulate the production of white blood cells. In some cases, androgen therapy might be used. This involves using hormones to stimulate blood cell production, which can be helpful for individuals with bone marrow failure. Bone marrow transplant is currently the only curative option for DC. However, it's a major procedure with significant risks and is not suitable for everyone. Regular monitoring is essential for individuals with DC. This includes regular checkups, blood tests, and imaging studies to monitor disease progression and detect any complications early on. Because individuals with DC have an increased risk of cancer, regular cancer screening is also crucial. This might include skin exams and other tests depending on the individual's specific needs. When it comes to Dyskeratosis Congenita, or DC, understanding the long-term outlook is important for patients and their families. The prognosis for individuals with DC can vary significantly depending on the severity of their symptoms and any associated complications. Some people might have mild symptoms and live relatively normal lives, while others might experience more severe complications that can affect their overall health and lifespan. For example, if someone with DC develops bone marrow failure early on or experiences severe pulmonary fibrosis, their prognosis might be less favorable. These complications can lead to significant health challenges, and in some cases can be life-threatening. However, there is hope. Bone marrow transplant has shown to improve survival rates for individuals with DC, especially those with severe bone marrow failure. But it's important to remember that transplant itself carries risk and is not a guaranteed cure. And there you have it, a comprehensive overview of Dyskeratosis Congenita. We have covered a lot of ground today, from understanding what DC is and its underlying causes to recognizing its symptoms and exploring the latest management strategies. If this video intrigued you, don't forget to like, subscribe, and join me next time as we uncover more mysterious medicine. See you next time.